To Pulling Threads, the podcast where we untangle patterns that shape our lives, our healing, and our relationships. I'm your host, Leslie Mathews, therapist, coach, and curious question asker. And today we're exploring the intersection of beauty, medicine, and empowerment. My guest is Lisa Hahn, a board certified nurse practitioner, educator, and the founder of Nueva Aesthetics, a boutique medical aesthetics practice here in St. Petersburg, Florida. Also, my friend and my personal aesthetics expert. Lisa has a background in critical care and wound healing that brings both medical precision and intuitive artistry to the world of aesthetics. In this conversation today, we're going to talk about her journey from hospital bedside to business ownership, the future of injectables and regenerative skincare, and how AI filters and social media are shaping the way we see ourselves. So, whether you're a skin enthusiast like myself, a fellow clinician, or just curious about the deeper meaning of beauty, this one's for you. Welcome, Lisa.
Thank you so much for having me. What an honor.
I'm so happy to have you here. You have definitely changed my life with all of your magic, and I trust you immensely with all things aesthetics. So we may uncover a few of my secrets today, but maybe not because there's so much to talk about. So
I
here on
appreciate
the
the
podcast,
vulnerability.
yes, we all things are on the table. I want to be real and authentic.
Absolutely.
With most of the guests that I've had on, I really like to explore not just what they're doing in the world, but also how you got here. And I think with women, it's so empowering to hear each other's journey because we all start one place and move through life with unexpected changes and pivots. So you started in critical care and wound care, correct?
My journey takes me back to the registered nurse that I was in the trauma ICU. It was a level one trauma center hospital in Philadelphia. Very busy teaching facility. I took care of critically ill patients fighting for their lives post-traumatically from car accidents, gunshot wounds, amputations, stabbings, head injury, car accidents, anything you could possibly imagine that is trauma related. We had a team of trauma nurses and trauma surgeons, and we worked very cohesively together in this ICU. We took care of a very sick population. They were on cardiac IV drips, intubated, sedated, and paralyzed. We had to take care of every organ. We dealt with a lot of life and death situations. Patients went down two paths. They either got better and they went down to a step down unit once they had the breathing tube taken out and they were stabilized, or they did not survive, in which case there were lots of conversations with the organ donation team. Those are very difficult conversations to have with family members. And those were kind of my roots. In this experience, I gained valuable knowledge of anatomy, physiology. I learned a great deal from my trauma colleagues. We learned how to be a team, work cohesively together. And I went back to graduate school while I was in the ICU, working 3 12-hour shifts on weekends and then going to
Wow.
school from Monday through Thursday. My life was pretty much the hospital and learning because the university was right next to this hospital. I went back to school to be an advanced nursing provider. And during my clinical time in my advanced degree, I worked with a general surgeon in the clinics and in the operating room both. And so it added to my knowledge of anatomy and physiology. And I learned how to become a first assistant in the operating room. I learned how to take care of patients, inpatient, outpatient, did a lot of procedures in the operating room and out of the operating room. When I graduated from my graduate program, I took a job with a vascular surgeon, and I went into a little bit of a different subspecialty, but still in that general surgery realm, and
Mhm.
learned a lot about vascular issues, vascular problems, circulatory problems, and issues stemming from problems with the veins and the arteries. And so
Right.
at the time of that position, I actually had the pleasure of working with a wound care provider. Her name is Sarah, and I believe she's still there at the hospital. And she took me under her wing. She taught me so much about wounds and how intricate the skin is and how the organ is so protective and so regenerative. I learned how to heal wounds under her supervision and general wings. I learned to just love skin. And that's kind of when I've sort of started with the exposure of skin and how it heals and regenerates, what you need for skin to heal, what makes skin heal faster, and what allows for skin to heal a bit more latent. So, lots of valuable information from that position. I left Philadelphia. We moved to San Diego, and in San Diego, I was lucky to found a position in the Department of Head and Neck Surgery at the University of California, San Diego, under the supervision of a world renowned surgeon, Dr. Jeff Harris, a
Mm.
world famous otologist. I learned a great deal about head and neck surgery, also anatomy of that particular subspecialty. And so I think it kind of brought me to where I am today. I've loved the skin, I love the anatomy of head and neck. And so, kind of in the process, is just kind of landed where I am now. But several years from that position to where I am now, about 10 years ago, I started working with devices and lasers and really gained a lot of knowledge from that position as well. Started to understand skin in a different aspect because instead of healing skin from the inside out, I started working with devices and lasers and understanding how different wavelengths of light integrate with different parts of the skin and how we can achieve certain results based on what devices we use. So learned again anatomy, skin physiology, understanding lasers, and really ramping my knowledge up with devices. And so when I was in that position, I was asked to work out of two different medical spas in the Tampa Bay area, starting to doing injectables and kind of put myself back in school again. I had a colleague in St. Pete who was an esthetician, and she asked if I could be her Botox dealer. Could you come and like Botox my men and women who want, their every 3 month tox? I'm like, yeah, sure. I
Right.
mean, sounds fun. And I'll do that all as my fourth side gig. And so I just developed kind of like a little sub business out of that. And that just kind of grew
Wow.
to an organic business. I really didn't dive into any social media at the time. I didn't do any marketing. I was just word of mouth and referrals. And next thing you know, I'm renting a room and buying devices and just kind of happened organically. It's kind of where I am today. Everything I've done in the past may not have been direct medical aesthetics, but I also think it's a newer subspecialty in the world of medicine per se. And so I
Mhm.
feel like because I've had previous knowledge in different ways, I've kind of been able to put all that together and really understand the current modalities that are out there and just tying that all in. I think that's my advantage, having that past experience and tying it in with the newest and greatest. And so
Right.
honestly, I just love demystifying this stuff for people because
Yeah.
it's really confusing.
Yeah. It's
Do you
very
agree?
confusing. I think your journey makes perfect sense now, even though I'm sure while you were on it, it didn't. And I
Yeah.
think that's so true for many of us, like where we end up when we can look back. We're like, oh, of course I needed the wound care and to understand the anatomy through injuries and in critical care, getting expertise from all of these people. Then I learned lasers and light and all of these things. While you were in the process of gaining all of that knowledge, it may not have made sense, right? Like,
Hmm.
and you
Hmm.
didn't, you found your way there. And now you have this incredible set of tools and all of this knowledge and understanding that's really unique to you. And it really comes through in your practice. As a patient, I can say your understanding of where everything needs to go and how the lasers are going to work. And I'm a science nerd too. So I like to understand.
Love
I
it.
wanted, so I love our conversations when I come in because I'm sure there are people who don't care, and you
Yeah.
probably just laser them and inject them and do whatever, and they move on about their day. For
Yeah.
who want to know, and I'm going to share, you invited me to come to a training, which I loved. At the training, the trainer was going into the anatomy and talking about why they were placing the injections in certain places, which I was loving.
You were a
I feel
good
like every
sport.
time I come in, I get a little lesson, and I love it.
I also have a teaching background. I taught at two universities, both clinically, undergraduate, in the graduate program. I do love to teach. I feel very strongly about taking care of our young providers because we're going to need really good, competent providers. As
Yeah.
we
Yeah.
start to age and start to need things, I think it's really important. I'm a big fan of educating. And to your point, understanding the what and the why of everything.
Yes.
You don't ask the why, you'll never understand why you're doing what you're doing. It'll
Right.
never make any
Right.
sense. I appreciate that input from you, and I can tell that you also love learning as well. You have a lot of
Yes.
degrees too.
Yes. If we look back at mine, they definitely did not make sense as I was getting them. When I was a speech pathologist, I didn't know that I was going to need to understand neuroscience. And while I was in a neuroscience lab, I didn't know the neuroscience would someday help me with mental health and being a therapist. And I certainly didn't know being a law student studying health law was also going to help me understand and dig into divorce processes, helping clients navigate the system. How I got here to be a therapist, um, I did circle back to neuroscience, which I always
Mm,
think is interesting because I feel like that's the bulk of what I'm working with people with trauma is
yeah.
really understanding a lot of the biology of why we attach and all of those things. My journey
Mhm.
is wasn't linear. It did make sense. There's certainly a lot of skeptics about whether I was just collecting degrees.
Well, it helps that you're smart. So yeah, it's probably very easy to you. That's great.
Yes, I think being smart and curious is they're the two of the great gifts that you and
Yes.
I were probably both given. So, working in aesthetics, like what is your favorite part? What's, if you can name one thing, like your favorite part of your work, what is it?
Working with people like you. I know that relationship building with patients is the best part. I'm confident in what I say, I'm confident in what I do and how I do things. Building that relationship to that maybe you gain the
Mm,
trust to trust me, make those suggestions. So definitely building relationships, bar none, is
yeah,
my favorite part. I love procedures, always have. So doing things
yeah.
with my hands is very important to me. I always tell patients, you don't want me taking care of diabetes or your high blood
Right.
pressure.
Right.
I do love anything and everything that has to do with devices and procedures and working with my hands, that brain motor coordination and being able to process that through. I feel like I landed in my perfect
Mm,
position finally
yeah.
after doing all these different things that have led me to where I am now. I feel like I'm where I'm supposed to be. And it's a great feeling. I hope patients feel that as they talk to
Mhm.
me. And yeah, I think also demystifying the subspecialty of medical aesthetics and
Mm,
also trying to explain to people that, these are medicines. These are medicines, no different than if I wrote you a script for a diuretic and
mm,
thyroid medicine. These are prescriptions. And
right.
the only real big difference is that they're elective prescriptions. So nothing is an emergency,
Right.
but they're prescriptions. These are treatment
Right.
plans that have been thought out and have been curated to each individual for whatever
Hmm.
need they have. I love sitting down with patients and doing consults and answering all their questions because this field is very confusing and it can be very expensive. And
Yeah.
there's so much out there that it's like, where do you start? Right? People come and they're
Right.
like, I have this problem or I want this result. Where do I start? That's my favorite, building these relationships with patients. I love having these consults and talking very candidly about things. And then
Hmm.
my hope is that I build a treatment plan that's specific to you. I tell patients this is not a sprint, it's a marathon. We have a
Yes.
very long time to achieve these things. There's no hurry here, and it's all elective. So doing it
Right.
when it's appropriately timed and doing it safely is always the forefront of any of
Yeah.
these procedures, period.
I think that we look at people, and we're going to talk about this a little bit later, but we look at people online and we look at celebrities and we think, oh, they got something done. And
Hmm.
one of the things I learned by working with you is this marathon idea, right? Like
Hmm.
the first time I saw you, I was like ready to go. What are we going to do?
Yeah.
And it was like,
Now.
okay, we're going to do this, and then we're going to do this, but we're not going to do it all at the same time. Now, we're pretty far into this process, at least a year or more, probably a year and a half. And I've never felt better about my skin, where I'm at, and how I look. When I first started seeing you, I think I knew I wanted to be on camera. And I was like, for me to be on camera, like I'm gonna need to feel good about how I look and how my skin is. And it wasn't immediate. We had to do things in the right order. And I loved how honest you were about the process and where we were going. And now we're at a point where we're just maintaining. There's no major improvement, more maintaining, which is also nice.
Hmm.
But you are so good at educating. And I really love and value that you know what's new and the latest and the greatest. There's fast improvement in aesthetics, in my opinion. And it's not, surgery is getting further and further away, right? Like down the road, if necessary at all, because of the collagen building technologies that are out there. So that's, I guess, what I want to talk about next is I
Hmm.
think that the advancement in aesthetics that are currently available are incredible, and something new is coming out every day.
Hmm.
So, what's coming and what are you excited about?
I know for trends of 2025, it's regenerative medicine, medicine that's utilizing the most natural ways of regenerating skin, using your blood as its own form of a filler, using blood components to regenerate the skin, using exosomes, either stem cell or plant-based, to also regenerate the skin. I think there's a trend bringing back that 90s natural look. In my opinion, keeping things back to basics, keeping the skin fresh, keeping the skin revitalized. There's a lot of devices, lasers, and treatments out there that do all that. I
Mhm.
think skin, and maybe I'm biased because I like the skin so much, but I feel that's keeping the skin youthful is very important. And that comes with taking care of your skin and
Right.
incorporating different treatments. I think that's the trend. There's still room for the neurotoxins and the fillers for sure. Everything is used together to get to the result is a 100-piece puzzle. Just have to put the pieces of the puzzle together at the right time in the right way. Again, keeping it safe for the patient. But it's not a one-all, right? It's multifactorial treatment plan usually.
Yeah.
So I think that's the trend. You see a lot of bad outcomes out there in the social media realm and LA and the film industry. And I feel like people are starting to revert back to more of a natural look about them.
Yeah,
Wouldn't you agree?
I definitely agree. I think the overfilled days are
Mm.
coming. I didn't know if that was because filler is improving or if we're just using less of it. But I wanted to ask you, when you said regenerative, by that, do you mean mostly lasers and products that are doing something to the skin to cause it to create its own collagen? Is that what you meant by
Exactly.
that?
Using modalities, whether it's mm, injectable medications or devices to allow your own body to regenerate collagen and elastin. Those are the structures that create that volume, that plump, that glow. Anything that we can do to regenerate our own cells to get to that is, I think, the trend.
Okay. Yeah.
And when we have,
Yeah.
you turn around and there's a new serum that does this and it does that. It's amazing how quickly this stuff changes, but all scientifically backed. It takes a while for the stuff to come to the surface and for us to be able to get it into our hands. It's got to be tested and proven, and it has to be FDA cleared or FDA approved. So it takes time for these things to show up in our hands as
Hmm.
providers to use.
As consumers, and there is some fatigue with this idea that all these products are promising something. In the past, I think there were a lot of products that promised things that they weren't actually able to do. And but now it almost seems like with the exosome, there are some incredible products out there that work. And some of them
Mhm.
are prescription and some are available with in professional clinics.
Mhm.
It is a bit overwhelming as a consumer to decide what line of products you're going to use, which ones are good. And within some lines have good things and others. So
Mhm.
I also know that there's tons of new technologies too. So if you go online and you look for a provider as a basic consumer who doesn't know much, it's going to be really overwhelming to just try to decide who to see and based on their technologies. How do you decide like which products to use, which technologies to use with individuals? Because I know that you really make a very personalized treatment plan based on what the person's goals are.
Great question. I listen to the patient, I listen to their needs, I listen to their budget concerns,
Mm,
listen to what type of lifestyle they lead, I listen to what concerns them, and I usually can get to some sort of happy medium that way. I listen to, are they caretakers? Are they moms? Are they busy corporate individuals that don't have the time for me to prescribe 10 different products? I mean, you have to be realistic, or else you'll end up having, from a product standpoint, some sort of product graveyard in your bathrooms.
yeah,
I
yeah.
don't want
I
that.
I have a product drawer.
And to a degree, a product drawer is good because then you can kind of mix and match depending on the weather, the season, the
Yeah,
dryness and that kind of thing. But there's staples out there, right? That they don't
right.
have to break the bank. I pay attention to, first thing I ask is, what do you do for a living? Because if you don't have the ability to have any downtime, then that eliminates X,
Mm,
Y, and Z. If you're someone that has to animate and you don't want wrinkles but you have to be able to animate, well, we need to have that
yep.
conversation, right?
Yeah.
I listen, and then we have a very realistic expectation discussion. I usually have them stand in front of the mirror with me, or I give them a handheld mirror where I show them the iPad with their photos. And it's interesting. Most people come wanting to change asymmetry. Well, there's a saying in plastic surgery where asymmetry exists, asymmetry persists. I mean, there's so much you can do even with plastic surgery.
Yep.
So realistic expectations is very important for all patients, whether you're in your 20s, 30s, 40s, men, women, whatever the situation is. Also, I get a lot of patients that have something coming up in 6 months or 9 months. And
Mhm.
so that also deviates the treatment plan, right? So we do things that are going to add the most collagen to the collagen bank, right?
Yep.
And then we kind of work our way there. So yeah, I just pay attention, I listen, and
Yeah.
then we kind of just come up with a treatment plan together.
Great. Is
That's
there
the strategy.
one product that you see that you think will never go? I'm thinking of Botox. There's tons of science. It's been around for years. It's not going away. Is there anything like that, or do you think anything is replaceable when?
Oh, I think you hit the nail on the head. Neurotoxin, wrinkle relaxer, Botox is one of the six that we have now on the market. And I also think from a skincare perspective, any type of tretinoin or
Mm,
retin-A or retinol is key. So if there's nothing else, just get a good
right.
moisturizer, get a good SPF, and get some sort of tretinoin, vitamin A to expedite skin cell turnover, because
Yep.
that will, right, help
Right.
with that glow. But consistency for sure.
Yeah.
But yeah, I would say neurotoxin. The United States just got its first Korean neurotoxin. I have not used it yet, but it is from Korea, and it is also a botulinum type A neurotoxin, so similar to what we have on the market with the other five. But hey, that's exciting, right? What does it do differently? Does it kick in faster? I've been
Yeah,
in touch with my colleagues that have started to use it. So we'll have others come to the
yeah,
US market and others that'll probably use a different type of toxin, like maybe toxin E.
right.
There's research out there now with different types of toxins. So how does that look? Does it kick in faster? Does it work longer? What's the spreadability like? I think a wrinkle relaxer and a good skincare product are staples that probably won't go away anytime soon. I mean, you can
Okay,
see it's evident because we've now at our sixth neurotoxin, so I can't see it going
right.
away. Botox from Allergan has been around for a long time therapeutically, and
Yeah,
they also have an indication for cosmetic Botox. So, I mean, I can't speak any more highly about Botox. This has been around for a long time and proven to work for all kinds of muscular issues, not just a
right,
cosmetic standpoint. So,
right.
yeah, I would think of both of those if that answers your question.
Yes. Like for
Yeah.
anyone who's listening who doesn't fully understand neurotoxin, Botox is kind of like Kleenex being tissues.
Yeah, it's a good
So
analogy for
Botox is
sure.
a, what you're saying is now there are multiple alternate neurotoxins. Botox has been around a long time. There's a lot of science with it, but there are additional neurotoxins now. And as I've learned, there are price differences with those. And there also are differences in how quickly they are become active and how quickly they wear off. Is that true?
Yes, for the most part.
When someone comes in, you base your decision on multiple factors of which
Mhm.
neurotoxin, if they're coming in for wrinkle reduction or prevention. Are we still doing a neurotoxin for preventative wrinkle prevention?
A great question. I'm going to use the opinion. It may not be a popular opinion, but I'm going to say prevention's tricky when we have a conversation with neurotoxins. I would say, without getting too scientific, we look at lines in the face as either dynamic or edged in. And that's really what we treat as providers. We either treat dynamic lines, so lines that move when you express yourself,
Yep.
or lines that are already a part of your skin. Those are called edged in.
Okay.
And edged in lines are a little tougher to treat. So I guess in that sense, if you want to prevent edged in lines, then yes, you have to treat the dynamic lines. Does that make
Okay.
sense?
Absolutely.
The
Absolutely.
60-year-old with edged in lines from that have been there for 20, 25 years are going to be a little tougher to eradicate with just Botox alone. And
Right.
that's when I bring in
That
my
makes sense.
devices and my lasers,
Because there's something
good
already
medical grade.
there.
Yes, it's edged
So,
in, it's
okay.
part of the skin. And those are
So,
trickier. But in that case, I
so
guess it is preventative.
I don't have a lot of lines on my head, probably because of the timeline I started Botox. They're not edged in, but they would be there at this point had I not started doing injections earlier
Correct.
in my life. So I think what you're saying is if I already have the edged in lines and I came to see you, then we would be looking at lasers and other things to try to rebuild the skin there or smooth the skin instead of what we're currently doing, which is injecting to keep lines from forming. Is that right?
Yes.
Okay.
And that is all based on patient preference. If they said, I don't care that I have etched in lines, I don't even see them, I could care less, and we're not going to worry about it.
Yeah.
But
Yeah.
if, they're 32 and they're very expressive and they have a lot of mobility, and I'm starting to see that mobility is starting to then etch into the skin,
Mm,
then we have a pretty good chance
yeah.
of preventing them from being etched in. Yes.
Okay.
Sorry, I didn't mean to interrupt
That's
you.
okay.
Especially people that are very expressive. So I spend a
Mhm.
lot of time watching people animate when they're in my chair. And as they talk to me, what do they use the most? Do they use their forehead the most, or their eyes, or their
Mm,
mean, growling face? I do a lot of assessing as I talk to them
yeah.
and really see what would be the most beneficial when it comes to a treatment plan.
I love that. Have you
I'm
noticed?
assessing as soon as they walk in the
I know
door.
now the next time I come in, I'm going to be like, she's looking at my face.
You want
No,
me
I
to, because
do.
I need to know, do you move that right eyebrow a lot? And is that like your
Right.
mean mommy eyebrow? Because if that's your mean
Yeah.
mommy eyebrow, that needs to stay your mean mommy eyebrow.
I want you paying
Right?
close attention because I've got this dimple which throws all of my, makes it all more complicated. I want you to know where my face is going. Have you noticed
Absolutely.
a shift in patient goals or demographic that changed over the past few years in your practice?
Oh, for sure. Social media has helped bring medical aesthetics to the forefront as a subspecialty and as treatments that we can all afford and be part of. It's helped us tremendously, just putting it out there in the public eye. I get patients as young as 18 and, you know, lots of questions about, well, what can I do to prevent this, that, and the other.
Right.
20s for sure. I'm getting more of late 20s and for sure 30s. I love
Yeah.
what's like a great age group is 30s, right? What can I do? It's not that complicated, right? We
Yeah.
go through a treatment plan. I would say 20s and 30s for sure. That generation pays attention to social media, the Instagram, the TikToks, to celebrities being very upfront about
Mm,
what they're doing.
yep.
And so it's great conversation starter as far as I'm concerned. I never worry about what have you heard in the
Yeah.
videos that you've seen. I don't worry about it because I know that what I engage in is scientific peer
Right.
review journals. Sometimes I have to walk them through what they've heard, but yeah, for sure. I get a lot more patients definitely in the 30s that are like proactive. Here's my yearly budget. What are the things I can engage in
Right.
consistently and help me along this journey in my 30s? I think it's great. We didn't have this when I was in my 30s. We had
Yeah.
baby oil
No.
frying our
Right.
skin. I
Right.
tell them, I said, you're so fortunate to have access to all this
And
and
to
to
have
have,
parents who put sunscreen on them when they were
yes,
that. We didn't have
mhm,
that. I agree with this.
absolutely.
Even my 14, almost 15-year-old, she's learning about products on TikTok and so skincare. And Jack's 12, he's looking at hair products. And
Hmm.
I'm like, wow,
Hmm.
like good for them, especially if they're using it to educate themselves, getting at
Absolutely.
the forefront preventative.
Hmm.
I was always telling Ella the importance of sunscreen and she didn't listen. But now she's seeing information on TikTok about it. And she's like, does that makeup have the sunscreen in it? And I'm like, yes, finally. It had to come from someone else. But I wanted to ask you if I am the only person who's ever came in with an AI generated photo of themselves and said, look, I want
Oh,
to, do you remember that? Like I came in and I had
yes.
gotten headshots created with AI and they looked just
Right.
like me, except there were some slight enhancements, I would say. And I think we looked at my lips and my cheeks maybe, and I was like, oh, can we do this? Like, is that something people, I know on social media people come in and they show pictures of someone else, but now we have AI.
Hmm. Yeah.
And AI
Yeah,
really does make us more symmetrical, I think.
for
And
sure.
it, so what's your experience there?
Not a ton of patients coming in with AI generated. I usually ask them to pull up a picture of, let's say they're in their 50s or 40s, pull up a picture of what you were like in your 20s or when you were
Yeah.
25, when you were
Yeah.
30. Sometimes the memory gets jogged differently.
Yeah.
When they pull up a picture of 15, 20 years ago, they're like, oh, yeah, I really did have that, huh? Like, yes, you
Right.
have it now,
Right.
you had it
Yes.
then.
Yeah.
Always had it, and it's super cute, and I wouldn't change it. So
Right.
there's those conversations. But yes, people later in life, 40s, 50s, that want a certain look. Pull me a picture when you got married, or pull me a picture when you engaged, or pull me a picture of you
Mm,
when you were 32 years old. When we work with dermal fillers, we look at a face and use fillers to fill in shadows and allow for light reflex to bounce in the right places. It should volumize an area that's deflated because we have deflation. and descent of everything in our face as we get older. But not only volumize, but when you volumize, you actually bring the light reflex back to where it used to be, and we
Yep.
fill in shadows where they were not before. And shadows
Yeah.
sometimes exist early on in life, right? They exist in their 20s and 30s. And I do filler in plenty of people in 20s and 30s because they have a little bit of retruded jawline, or they have a little bit of an overbite, or their cheeks are not quite as prominent, and so there's reasons why you use dermal fillers in the younger years, and as we get older it's more of a volume replacement. So when you explain that process, it starts to make more sense to patients. There might be a little bit of a taboo for people in their 50s and 60s, are like, oh, my neighbor uses fillers, and
Yeah.
well,
Yeah.
why wouldn't she? We have it to our disposal. Don't you use a
Right.
highlighter for your cheeks every morning when you put makeup
Right.
on? Don't you want the light reflex to bounce where it should be bouncing? That's why you use a highlighter, right? When you
Right.
start
Right.
explaining that strategically when you place fillers in certain spots, that's the end result. So it's shouldn't look fake or false or phony. It's definitely a shift in thinking. I really appreciate when younger people come in and start asking for more preventative things. How can I get to this result when I turn 35, or now that I'm 38
Right.
before I get to 40? I love those conversations. They're very organic and easy to have. It's really the mainstay of medical aesthetics.
Yeah.
I would say more of, back to your question, I would say I get pictures all the time. And this is what I looked like when I was 25.
Yeah.
Yes, her lips were fuller, but it also helps me because when we do age and we have the descent and the deflation in the face and neck,
Mhm.
things do change. The lips get smaller and kind of come down. So when I have that picture of when they were 25 and they're now 45, and I'm like, see, understand your anatomy, and this is why this has happened. So you go back to the root cause of things. It's easy to explain to people.
Yeah.
Fixing the root cause. Oh, I see. Now I understand why my lips look the way they do, or my jawline looks the way it does. Fix the root cause, and then you're going to
Right.
hopefully fix the problem that you want to get fixed. Does that make sense?
Yes.
And
And
I think
in
that's true in
most
any
cases,
age.
yeah. And in most cases, especially in 40s and 50s, we just want to either maintain or get back to where we were before, because that's how we
Mm-hmm.
see ourselves. I know we're
Mm-hmm.
going to touch on mental health related to this in a little bit, but I think it's important to understand that it's okay to want to look the way that you feel. Meaning, this is the way when I close my eyes and I see myself still as a 25-year-old or a 29-year-old
Mm-hmm.
old, I don't feel my age. I want to look that way too. That's
Right.
okay. People get so caught up on it and let's age gracefully, and then there's a little bit of shame. I feel like we've rounded a corner in the world, and maybe it's just me and the people I'm around, but I feel like people are okay with wanting to love how they look more so than
Mm-hmm.
when we were young. For me, at least, growing up, it was this balancing act between you're supposed to be beautiful, you're supposed to look good, but don't think you do. Whereas
Absolutely.
now we're really embracing it and saying at any age, it's wonderful to love yourself and feel beautiful and love what you see when you look in the
Absolutely.
mirror. You need to do that, great. Yeah,
Absolutely.
yeah.
Yes.
Now, the flip side of that is I think you and I touched on it before we got on this call. We have celebrities, and we touched on kind of like the overfilled days seem to be behind us, but now we're getting these celebrities showing up looking incredible and natural. So
Yes,
I'm
yes.
specifically thinking about Lindsay Lohan, who got a lot of publicity. Kris Jenner just
Hmm.
came out and she looks like her daughters, despite being, I believe, in her 60s.
She's 69.
And so I understand there are some new surgical procedures. I heard about the ponytail facelift, and those are not things that you're doing. But especially with Kris Jenner, she's 69 and her skin looks incredible. So, yeah,
Hmm.
she got
Hmm.
surgery, but also she's not crepey. She looks incredible.
She does.
And it's her makeover, and I think Lindsay Lohan's were very dramatic, but
Hmm.
extremely useful. And are they doing one thing? Are they doing many things? If you had to guess what
I had
they're
to take
doing,
it. Yeah,
what?
there's a lot of that out there too. I have to keep up with all of this as well because I get questions all the time. Like, what is she doing that I could be doing? Well, she
Right.
has a larger budget, number one. So
And
if
a
you have
team.
that
She's got a
budget,
team.
yes, she's got a team. She's got a medical aesthetics concierge team at her disposal at any
Yes.
time. How wonderful. With an unlimited budget, how wonderful. Yes, obviously, if I take her photo and I dissect it from before and after, Lindsay Lohan, I think she's 38, she'll be 39 soon. And I wouldn't take plastic surgery off the table for sure. I think looking at her before and her most recent photos, I would
Hmm.
say possibly an upper bleph. So, taking the extra skin off
Uh-huh.
of the upper eyelid
Yep.
and possibly a little bit of a endoscopic brow lift or maybe a little ponytail lift. Incision is back here at the hairline, so never be able to tell.
Yeah.
And I don't know about a lower face neck lift. I can't quite surmise if that's something that she had done, but the first two that I mentioned, she definitely keeps ahead of her skincare. She
Hmm.
is very, like, literally and figuratively, she is glowing. I know
Yeah.
she's done a lot of mental health work. I think she's done a lot of inner work and she's done a lot of outer work, and I really feel like she's figuratively glowing at this point. You can just
Yeah.
tell that she feels good on the inside and good for her. Amazing.
Yeah. Yeah.
I think plastic surgery is an amazing subspecialty. I still treat patients that have had facelifts and neck lifts all the time. Surgery is to replace or take excess skin and
Right.
and put fat back to where the fat used to be and all those good
Yeah.
things. But listen, after a facelift, we are still on the conveyor belt of life,
Yeah.
losing
Yeah.
collagen and elastin, doing these medical aesthetic procedures, still kind of slowing that conveyor belt, if you will. So I have plenty of patients that have had facelifts and now they come to me. Their surgeons are like,
Right.
okay, now you've been discharged from my care. Keep it
Right.
up by doing the lasers and the devices that will maintain that beautiful glow you now have. I think that's probably something that Lindsay Lohan engaged in. She does a really good job with microneedling, lasers, and skincare. She's consistent with it all. And
Right.
that's a big piece of this. I think she looks amazing. I think she's also had a rhinoplasty to slim down her nose. I can't tell, but just based on the before and after the appearance, those are
Right.
my educated guesses based on
Yeah.
what I do for a living. So, as
Well,
far
she's
as
all I think of someone who cut back on, because if you look at her past pictures, she had a lot of filler in the
yes,
past, and that's a huge improvement. Whatever she did,
yes,
it's a huge improvement.
I feel like she's had some filler dissolved
Yeah.
and has been placed strategically in the right places to sculpt her face and bring
Yeah.
back that natural light reflex where light reflex should bounce and fill in some
Yeah.
shadows. Her jawline is real crisp. I don't see any excess skin. Some of that stuff at her age could be done with fillers in the right place, right? You can
Yeah.
sculpt the jawline if it's the right patient with the right type of
Right.
skin.
Right.
So, yeah, I think she looks great and I think she should show herself off.
Yeah. I think the filler, some of the fillers she had in the past actually aged her.
Hmm.
And I learned myself with the filler dissolve because we did a little filler in my lips, and you told me I had to get my old filler dissolved, and I felt scared
Sure,
of that
sure.
because I don't know that everyone realizes that it's gonna move around and you feel like it's no longer there, but you don't realize it just moved somewhere else.
Hmm.
Some of it wore
Sure.
off. So that I think that I love the way my lips look now. We probably dissolved more than what I have now. We had to get rid of what I had before first, which was great and scary at the time.
Listen, it's
Yeah,
our magic eraser in aesthetics. We have this great reversal agent, and we can use it to erase whatever we don't like. And obviously, we use it for any potential complication as well when we
right.
use filler in the face, but it's our little magic eraser.
Yeah, it's a good one.
Yeah.
Okay, so let's talk about the basic goals for different age groups. If someone came in their 20s, what would be the top three things you would tell them?
I would say wear sunscreen, mineral base SPF, and use it every day, not just when you're going to the beach. It needs to sit by your sink because all these lights we're exposed to, the computer screen, all of those bounce UV rays back onto our skin. So I
Mm.
always tell patients like this cumulative, it's not because you only ran outside for 5 minutes to walk your dog. This is an accumulation of UV rays doing damage to your skin. So definitely
Okay.
sunscreen. And there's so many good ones out there. We're lucky to have such a great variety of them, tinted, untinted, and
Yes.
mineral, sensitive skin. The sky's the limit. My second is get a good moisturizer to keep the skin moisturized. In their 20s, if they're starting to have some issues, target those issues as the third thing in line. So if they've got some acne breakouts, so maybe incorporate some chemical peels, start incorporating some tretinoin, maybe some vitamin C, just things that will help the skin stay regenerative, right?
Yep.
So that third piece depends. I do
Right.
plenty of laser work on 25, 27-year olds. Depends on their issues. I get ladies that were pickers when they used to have acne. Now they
Right.
have hyperpigmentation in areas that are bothersome to them. So let's introduce a non-ablative laser or some sort of device that will start helping transform those dark areas. So yeah, I would say sunscreen, a good skincare product, and then that third one can be if there's something particular to their needs.
Okay. Good. What about 30s? I know the sunscreen will carry over to every age group.
30s is when you can start pulling the trigger on some devices and treatment modalities that will start visibly seeing a difference because we start losing 1% of our collagen in our skin in our early 30s. You've got so much collagen in the collagen bank to start with, and you're just trying to make deposits into that bank on a yearly basis. So things that don't break the bank, that don't give you a lot of social downtime, like microneedling, chemical
Mm.
peels, even doing facials, just topical skin glowing facials where you put
Yep.
a little bit of glycolic acid or lactic acid into the skin. Those are imperative in your 30s. Are you
Yeah.
having any pigmentation issues? Are you starting to see fine lines that you don't like? Let's then target it.
Okay.
Sunscreen definitely in that top three. I
Yeah.
love
Yeah.
microneedling, by the way, for people in their 30s.
Great.
I
Great.
love
That's a really good.
microneedling.
Yeah. The downtime isn't bad with
No.
microneedling. Okay. 40s.
We're definitely in our fourth decade of life. We've been around the sun a few times. Some have not been good about sunscreen. So definitely have to bring the laser in.
Mhm.
If your long-term goal is skin, right? Got to
Yeah.
bring a laser. Maybe we're starting to do some fillers, definitely neurotoxin to help those muscles stay a little quieter so that you don't start getting those edged in lines. So one of the again the top three may end up being top five in the 40s is injectable biostimulators. I love my early 40s people to start getting biostimulators into their skin. That is a great regenerative, skin boosting, collagen boosting procedures that we can do that or you can do under the radar. It's basically allowing your own skin to regenerate its own collagen. And it takes time, right? It's
Mhm.
not overnight. So start earlier if you
Yep.
can in your 40s. And then using fillers and Botox as you need to. But definitely incorporating some devices in
Yeah.
your 40s. Usually by your 40s, you start seeing sunspots and you start seeing in your dry side, maybe a little bit more laxity or more sun exposure. It's hard to escape that in your 40s.
Yep. Yep.
Yeah.
And then we move into our 50s, but I want to say for women, I know you see men too, but for women, late 40s and 50s, we're seeing more of a shift because of perimenopause and menopause. So does that change the game for women?
Yeah,
Yeah.
for sure.
Yeah.
It's a question I have in the questionnaire. Are you perimenopausal? Are you menopausal? Where are you at in your change of life? Your skin has estrogen receptors. So as your estrogen levels start to decline, you're going to start seeing changes in the skin.
Okay.
So dryness and that plumpness, you're going to start seeing that dull skin. And
Mm,
that's definitely something to consider talking about whether they want to talk to their provider about hormone replacement therapy and what that could possibly look like for them. Is definitely a key piece. But more so, I would think 50s, for me in my practice, it's really incorporating consistency in your daily skincare routine. A lot of my women in their 50s didn't really do anything until they were maybe 45, 48. So sitting down with them and educating them on staying consistent with whatever they choose, whatever works for them on a daily basis, just stay consistent with it. I get asked a lot of questions and people in their 50s about should I get a red light mask? And should I get a little
mm.
microneedling? Should I get a little roller that I use at home? And my answer to that all is yes, but
Yes.
just make sure it comes out of the box and make sure that it
Yeah.
gets on your face and your neck.
Yes. Yeah.
And I
Because
also
red light
tell
is
women,
incredible.
well, yeah, you and I have had
Yeah.
lots of conversation about
Oh,
red
yeah.
light
I
and
love my red
for
light. Well,
multiple
it's,
reasons,
yes. Um,
and
and
not
we're going
just
to
skin
get to it in a sec.
concerns.
Red light is incredible. I
Oops.
feel it when I don't use it, and I really see it and feel it when I do.
Hmm.
So let's do 60s, and then I want to come back to red light on another topic real quick. But 60s
Yes.
and up, we're just gonna, I know
60s
that
and
there are
up.
needs, but we're gonna
Yes.
group them all together.
60s, I would say, depends on where they were in their 40s and 50s with skincare. I think women in their 60s are either they've had a facelift, they're thinking about a facelift. I feel like they kind of divide into never ever going to have plastic surgery or I'm on the path. Different conversations to have, but for sure, devices, consistent skincare. Whether you're 40s, 50s, or 60s, I always tell women, men, take at least a year to a year and a half of no fillers or biostimulators. We call it a washout. If you're
Okay.
thinking about a facelift or on that path to getting one in the next year or so, make sure when you get your consults that you do a washout, right? No
Mm,
injectables for a time being because that surgeon wants to be able to do surgery on the cleanest face possible so that
right.
layers are layers, right? Because the face is, well, anything. You've got layers. It's part of the anatomy. It's just easier for the surgeon to do their dissection and to
Yeah.
move the skin and the smaz and different parts of your skin to where it needs to be if there's nothing there. So
Yeah.
it just makes for better results. I will always tell patients that if you come in to see your surgeon with really good skin, makes their life a lot easier as well.
Yeah.
If they do nothing
Definitely.
for a year, if they don't do any biostimulators and they don't do any fillers, at least take care of your skin with good skincare, lasers, just some modalities to get the skin in the best shape it can be. It will make their life a lot easier. It will strengthen the skin, which in return provides for better results. Women in their 60s, I have to kind of feel them out and like, where's your head at? And what are you looking to gain? Honestly, a lot of women in their 60s just kind of want to like maintain, or they
Yeah.
usually have an event coming up. There's usually some sort of timeline of why they want to do certain things.
The answer to my question I'm about to ask you. But for someone who has some damage or things they want to improve, but they're on a really tight budget. So, what are your recommendations for someone who comes in on a really tight budget as far as what you can do for them with the most bang for your buck, right? But also red light, just because it can be a pricey device. You can also get
Hmm.
a less expensive device, but it's something that you can do at home. I mean, the science for red light therapy is just, there's so much, right? Like, I've
Hmm.
never heard anyone say red light doesn't work. So, what are a couple of options for someone if someone said, I want the glow, I want to look more youthful, but I don't have a huge budget? What would you recommend?
It's a very loaded question and probably not an answer I can do in one sentence. But to your point, red light is amazing. They always have sales with some of these really good companies that provide scientifically proven and scientifically backed red light. It has to be for home use, so they can't be medical grade. I would say red light therapy is amazing and use it consistently. That's going to be the biggest number one factor. Even just a really good face wash and a good face wash exfoliator where you can get some of that dead skin off. Because let's face it, it's that dead skin that gives us dull skin. As we
Yeah,
get older, our skin cells turn over 45 days, 50 days. When we're young, they turn over in like 30 days or less. That kind of pushing the timeline is very, very helpful. So
yeah,
again, it's just red light, get a good face wash, get a good moisturizer, sunscreen, use all of that consistent, get a good skin exfoliator, and at nighttime use some retinol or some sort of tretinoin product. And that shouldn't break the bank. These products should last about 3 months. I usually try to change one or two habits, and I
yeah,
think that's plenty. Take this home, make sure your skin reacts well to it, make sure you like it, make sure you don't hate the smell. I always tell people your results are 30% what I do in the clinic and 70% of what you do at home. It's like going to the dentist and getting your teeth cleaned and then never
right.
brushing your teeth at home. What's the point?
That's
Those are just not even
yeah,
do it.
like using teeth whitener and then drinking a cup of coffee.
And
Forget it.
yes, exactly. Going to the gym once a month. No, you're not going to get muscles that way. It's all
Right.
consistency.
Here on the podcast, we talk about authenticity and all the things that make us feel good and make us feel like the most ourselves. I did want to touch a little bit on the mental health impacts of some treatments versus others. The biggest question for you, do you think that there are certain procedures or treatments or things that people do that have a greater on improving someone's mental health than something else?
Oh yeah, that'll load a question.
Yes, the question is more like, are there things that when you do them consistently, people are like, oh my God, this just makes me so happy and it makes me feel like myself again? Because
Hmm.
that's the goal
Hmm.
for me. The goal is to look as young as I feel and to glow as much as I feel lit up inside right now,
Hmm.
right? Like,
Hmm.
and
Hmm.
that are there certain things that have a greater impact than others in that way?
Such a great question. I can tell you so many anecdotal stories. I think anything that boosts your confidence, if you like the way, if you like what you see in the mirror, you're just going to feel more confident inside. You're going to walk more confidently. You're going to approach people more confidently. And that honestly varies from person to person. I have clients that come in, patients that come in, and I want to treat one, two, and three. They haven't even identified those as issues. They've
Yeah.
identified D and E. So if I start with D and E and get them the results that they're looking for, we can probably at some point start backtracking into the first three things I really think would benefit them the most. But addressing their issues of
Yeah.
concern, especially if they come in for an issue, they're going to walk out so much more confidently. I go back to skin a lot. So it's one of those things where I tell people if you don't want to do injectables and you don't want to do neurotoxins and you're afraid because what you see in the social media or in with celebrities, just treat the skin. We'll do some laser work. We'll do some more aggressive types of devices or treatments, and you will get so many compliments. And then I feel like when people start getting compliments is when they start
Oh yeah.
feeling good about themselves, right?
Yep.
And self-confidence is everything. It's the difference between being approachable and not approachable. It's the difference of being able to conduct yourself, right, in front of a crowd or in
Hmm.
one to one. It
Yeah.
makes a big difference. And so I see it all the time. I love being in a room, and I know I've treated 10 people in that room, and we don't talk about it, right? Nobody comes up to me and says,
Right.
"Oh, she's my injector." But I love how confident they feel, and they're eating up the compliments. Nothing makes me happier than to see that addressing what concerns them the most. And when they see improvement in that department, they feel so much better about themselves. And it could be anything. It could be this mole over here, or the vertical lip lines above their lip, or the deep crease in the lower face, or it could be that their mid face deflated, or They don't
Right.
like the way their eyebrow kind of sits down. It literally changes from patient to patient.
Yeah. It's vague, but it's a perfect answer because you're right. Like everyone sees themselves differently. When you look at me, you see one thing, I see something else. Um, Addressing what I see first, and then you saying, okay, like this, whatever we did looks great. We might also want to consider, every recommendation you've made for me has really improved my self-confidence even more. Right.
That's great.
So I loved what you said earlier about shadows. And I wanted to say we live in a time where we've never been on camera more,
Mhm.
and we use our phones to present ourselves, but we're actually engaging with people like this in Zoom and on camera. Our cameras have never been better, which means they've never shown more flaws, right? Like our cameras are HD cameras. I always laugh when people say, my clients who are dating and stuff, they're like, oh, they're using a filter. And I'm like, of course they're using a filter. Our cameras on our phones are showing every flaw we have. So we're seeing ourselves up close more than we ever have. What you did for me was give me the courage to get on camera more by addressing all of those shadows. I didn't know they were shadows. I just knew, I was like, oh my God, I see this and I see that and I see that line.
Right.
So I think aesthetics have to grow because we're going to engage more and more online, on camera. It's how our businesses are probably going to operate more and more, especially with AI taking off. The world is changing and evolving quickly,
Mhm.
and we still want to look our best.
Mhm.
I love that. Um,
Absolutely. Well, thank you. I'm so glad that you're the prime example, your testament and your experience. It's what we live for. Just knowing that you have gained some confidence. I mean, you're obviously a beautiful woman. You've internally gained that confidence to do what you wanted to do. I mean, that's
yeah,
huge.
yeah. Because if I'm being honest, there were things holding me back because I didn't like the way I was showing up on camera. So between the work you and I've done, figuring out some makeup tricks to help. Now I can confidently come on here. I can also come on more. I'm coming on more and more without makeup, but it's our choice of how we want to show up.
Absolutely. Absolutely.
Yeah. So
Absolutely.
I love that. And I feel like the work you're doing is having great impact on people's mental health. We all want to imagine ourselves at a younger time, even though I personally feel like this is the best time of my life. I am the best version of myself now. I like how I look and how I present. So
Hmm.
if I can look on the
Absolutely.
outside, my best on the inside, wonderful.
Absolutely. We're living longer, so why not?
Yeah. Yeah.
Right?
I can't thank you enough for coming
Mhm.
on today. Is there
Oh, such a
anything
pleasure.
else that you want to share with the audience before we sign off for today?
Oh my gosh, it's my favorite subject to talk about. We can maybe get a survey and see what people want to hear a little bit more about. Demystifying some of what's out there could be a great topic for the general population. I think we covered a lot, and it's been a pleasure to express my love for this field and to know that as a medical aesthetics provider, this is a subspecialty. I called myself a Botox dealer earlier. I joke only because I think I've gotten pretty good at doing neurotoxin in the face and neck, and
Yeah.
so pretty confident in that department. But it's medicine. And when we incorporate a treatment plan, we do it with you in mind and with the best intentions and with safety. So keep that in mind. Unfortunately, it is a cash business, so it feels a little salesy at times. And I can tell you, as clinicians, we're not salespeople, we're not trained that way, we're
Right.
terrible at it. But just know that any treatment plan comes with a good thought process and really keeping safety, efficacy, and results in mind. So definitely
Yeah.
worth having another conversation about in the future.
Absolutely. I love the idea of a survey, finding out what people want to know, what questions everyone has. I
Yes.
think this
Yes.
conversation has been a great reminder that, the aesthetics, it's way more what's on the surface. It's about confidence, it's about care, and really feeling fully at home in our own skin, which is
Hmm.
we want. Thank you for
Absolutely.
everyone. If this episode resonated with you, I'd love to share it, and leave a review and comments telling us what else we can share. You can tag us on Instagram. You can follow Lisa on her beautiful work at Nueva Aesthetics and check out her services and the team,
Wonderful.
other team members. So if you're
Hmm.
new here, thank you for joining us. Please subscribe. We'll see you next time. Thank you so much for being here today, Lisa.
Thank you. It was a pleasure. I'll see you soon.